Hey everybody, this is Daniel, and I just had to do a video about this, man. Like, this is too funny not to talk about. Our president, or the president, if he's not your president, this man said that healthcare is complex. He said nobody knew it was this complex. Nobody knew it was this complicated. This man does not know how to do this job. I thought he was, I remember him talking about being like the smartest, You know, I'm just the smartest, are just terrific, the smartest. And now this man's talking about, he's like, oh, healthcare is hard. Okay, so if you didn't hear what happened, let me give you a quick gist. Because it's going to be almost 7 years to the day on March 23rd, and Republicans still don't have a replacement to Obamacare. So here's what happened. President Trump was talking to some governors this week, and he mentioned that, nobody knew that the healthcare was so complicated or so complex. It's such a complex subject. Nobody knew it was going to be so complicated. And what's funny is, like, I'm sure everybody in the room was looking at him like, yeah, we all know it's complicated. We all know it's complex. You're trying to have this plan that's going to cover millions of people and going to have significant consequences on people's life and possibly death. I mean, you have people who are dying right now because they can't afford health care. People who are going bankrupt because of medical bills. Like, this is serious stuff. And what does President Trump say? The man says nobody knew it was this complicated. Like, yes, people did know. And another point related to this is the fact that Republicans still don't have a plan to replace Obamacare. Obama, it officially went into law March 23rd, 2010, okay? It's 2017, folks, and they still don't have a replacement. Right now, the plan that they are talking about is having some issues like in the House and in Congress because there's members of the House who don't like the tax credits that's being discussed because they think that's a new entitlement program. Whether it's a new entitlement program or not is kind of a different debate, and it's one that we can have. But I still find it funny that they still don't have a replacement. And I think when we look at President Obama's legacy, I've been critical of a number of things. I was critical of him in my last video. And the things that he should be praised on, because he's a mixed bag. There's things that President Obama did that were great, things that are yet to be determined whether they're good or not, things that are bad. But one of the things that it's gonna show over time that he's done is he really did kneecap Republicans for maybe the future by taking their plan, Obamacare, the Affordable Care Act. Yes, that's a Republican plan. And taking it from them and then implementing it himself, which I would have preferred single-payer universal health care, but I do recognize that for some people, the Affordable Care Act is not good, and for some it's a lifesaver, especially those with pre-existing conditions, those 26 and under. I understand that. It's a mixed bag. And for those of you who don't know, yes, Obamacare is a Republican plan. Before it was Obamacare, it was Romney Care. Mitt Romney ran it in Massachusetts. Before that, Bob Dole and Newt Gingrich supported it. Before that, the Heritage Foundation, a conservative organization, had done work on it. And before that, you go all the way to the first inception of the concept of the individual mandate. That was by a Republican, President Richard Nixon, who with his corrupt administration seems to have some similarities to the Trump administration, but going forward. So I just think it's really funny that President Trump now realizes how hard this is and how the Republicans, despite all the calls for repealing, all the calls for it, don't have a replacement. So this has been Daniel. I'd love to hear what you think about this, both Trump's comments and healthcare. We've had a couple debates on my Facebook page, so I'd love to hear what you think. This has been Daniel, and I will talk to you next time.